Hello, this is Burmese USA YouTube channel or Facebook educational page. How are you? It's been a while. I don't upload my videos. However, I have been thinking about all the videos and contents that I want to upload. I just don't have time. I have been working in the hospital right now for 12 hours night shift for 3 shifts consecutively. Then after 3 nights, I got 4 days off. However, that 4 days or 4 nights off, I did not sit still pretty at my house. I actually work in another place. So I have like 70 hours a week working. So I really don't have time to do anything with the YouTube channel or the Facebook educational page except writing some of the things that I feel like I want to write and kind of make a note for like a documentary. And you guys know or may know the purpose of my YouTube channel is the documentary of my life. So it's nothing to offense nobody or brag about my stuff or the status to make people embarrassed or make people small. I don't do any of that, so bear with me. And if you're into like any nursing, especially American nursing, Burmese who live in the America, anything to do with the visa from Burma to here, things like that, you can subscribe and follow so that whatever the video that I post may be beneficial for you as well. So as I keep the record for my life and success, and you may be successful at the same time too. All right, today what I actually would like to do is nothing much but studying of the cases that I've been through past several weeks. Since I didn't have time to do this kind of video, I have like pile of case study that I want to do as a nurse. But let's go through one by one and let's knock them down so that way I'm not gonna be like working but not learning. I want to work at the same time learn. That's the purpose of working for me. Okay, so one medicine, and this is all more about medicine learning. Okay, so one medicine that I common medicine that I see on the medical unit is Eliquis, or it is also called apixaban. Eliquis or apixaban, and that can be 2.5 milligram or 5 milligram depending on the patient's heart problem. So usually when patients have like atrial fibrillation, which means your heart is composed of atrium and ventricle, so this two part of the hearts, atriums squeeze the blood into the heart, then ventricle squeeze the blood out to the brain, to the other organs as well. So atrial fibrillation is like this atrium right here, instead of squeezing it like this, and it was actually doing this. So that's called atrial fibrillation. And when you have the atrial fibrillation and you're not really squeezing the bad blood like this. Well, I would say like, because you have like left atrium and right atrium, so you learn about the anatomy and physiology later time, but right now what I'm saying is the blood in the atrium got squeezed down to the ventricle, so the ventricle can squeeze it out to the whole rest of the body. So when the atria cannot squeeze like that, and when it's doing like that and the bloods are not like going down, when it's not going down, it's not supplying to the rest of the body. So for the people with the atrial fibrillation, doctors usually order Eliquis, either 2.5 milligram or 5 milligram. And sometimes, and it's also depending on the severity, and most of the time I see like twice a day, in like 8 a.m. in the morning and 8 p.m. at night, that we give Eliquis or apixaban for the people with the heart problem. And usually those kind of patients who have the heart problem, who are on the Eliquis, and if they are severe enough and the doctors want to put them on the telemetry monitoring, which is a heart monitoring that we or the heart monitor tech that she can see all the rhythms in the computer. And then usually per shift they print out the little, I don't have it with me, but they print out the one line, like a strip, okay, not the whole EKG that we used to see. It's the whole strip. So the strip, just like a 6-second strip, that for the nurses we can read how the rhythms are going. So if you ever heard about like patients on the heart monitoring, telemetry monitoring, that's what it is. Okay, and another medicine is Lipitor. Lipitor is also called atorvastatin. Atorvastatin or Lipitor. Lipitor, atorvastatin is for to bring down the blood glucose level. Blood cholesterol level. So people with the blood cholesterol level high, then they may be on that medicine for the long term. And for Lipitor, atorvastatin, one thing about it, and usually it is given at nighttime because while you're resting, the medicine works better. So like for example, like me, I do night shift, and if I supposed to be on that Lipitor, atorvastatin, and probably you can take it while you sleep, which is in the daytime. So it's really depending on what the patient's schedule is, and that's why it's really important to know about your patient's profile. What kind of job he does, and is she retired, is she a night person, day person, things like that. Because I used to have like a lot of patients like night people that they are up in the nighttime and they sleep in the daytime. So let's see how it does for them, okay? And MACOUS. MACOUS, magnesium oxide, is usually 400 milligram and it's given one in the day, one in the morning, and one at nighttime. That's to help you with the gas. So magnesium oxide, it is magnesium. So if the patient has low magnesium, when you give magnesium oxide, that will give the nutrients magnesium to that person. And also it can be acting like an antacid. Is the like stomach upset or heartburns or stuff like that. MACOUS is good for that. And also it can be treating for like gas, like I said. So because you have like very gassy, bloated stomach, when you have MACOUS, it can be treated for you to like go to the bathroom, go to, have a bowel movement. So all the air and the stuffs are out. You feel like lighter, better, feel satisfied. Yeah. So MACOUS is for that, and usually some people have MACOUS. Most of the time is for like constipation, like they don't go to the bathroom, and it's not just to soften the stool or making, because constipation medicine, those medicine laxative, and it can have like different effects. Like for example, lactulose, it will actually bring the water into the intestine. Then because it's so watery, it goes right, like bowel movement. And like for example, Senna is more like making the peristalsis, which is our intestine is moving, always kind of moving like this, and that Senna's will make the peristalsis moving a little bit more. So it's like pushing the stools down. Okay. So yes, metoprolol. Metoprolol, anything ends with LOL, law, is beta blocker. Okay, beta blocker. So if you want to know what is beta blocker and like a more detail, go to another just a beta blocker video. Okay, other than that, what I can tell you, beta blocker, when you give the beta blocker, make sure your patient's heart rate is at least 60s, because beta blocker can make your heart rate go lower. So if your heart rate is 60, that means 60 to 100 is the regular rate for the normal adult. Okay, so at 18 years and up adult, that means they are adult. And if your heart rate is like 59, it's okay. Like 60 and 59, 60. Okay, let's say just by the textbook. Okay, 60 and the 100. Okay, if your heart rate is 60 per minute or the 100 per minute, it's a good number. Okay, some people 60. When I'm like excited, I may be 100, or when I'm running around and I may be a little bit more than that. But the regular one, while you're resting state, while you're not doing a lot of stuff, and right now I will have like a 60 to 100 for the heart rate. So what I'm saying is metoprolol, when you give the metoprolol to the patients, when the patient is having the low heart rate, it's gonna bottom it out. I mean, like, then you have to treat it with the different other medicine to keep the heart rate up, because if your heart rate is go down and down and low and low and low and down and down and down and stop, that means asystole, die, right? You don't want that happening. Okay, Betroban cream, 2%. Usually that Betroban cream is also called, I forgot what that is. You can comment me below right there. Help me out. Betroban. I forgot the another name of it. It is Betroban cream, 2%. That's actually the consistency is like a little look like a Vaseline. The color is like little look like a Vaseline. It's a little tube that you squeeze it out and use a Q-tip. Then you just kind of take a little bit of the medicine and put it in the nose. So usually the Q-tip that we have in the hospital has 2 Q-tips in one little pack. So one to one nose, another one to another nose. So after you apply the Betroban cream to the nose, you do this just to spread all the medicine across everywhere in the nose. So that Betroban cream is to treat MRSA. MRSA is a very stubborn bacteria that is really hard to treat. It is really resistant to a lot of antibiotic. So what happened when the MRSA nose is the MRSA house, okay? So when somebody have the MRSA, the bacteria likes to stay in the nose, so they colonize in the nose. So people pick their nose and the hands didn't get washed and you forgot, and then you probably like scratch a place that's an open wound or something. The wound get MRSA as well. So the wounds that need to be like actually healed were not healed properly, and you were given some antibiotic, it will not heal properly because that bugs is really stubborn and it's hard to treat by any antibiotic. So by giving that Betroban cream to the nose, that will kill the MRSA in the nose. Not everybody has MRSA in the nose. So usually those patients who are in the community, like nursing home, because it's very crowded, a lot of sick patients, and patients can have MRSA by staying in the hospital for very long too, because hospital is the dirtiest place in the world. I mean, like, we are really like dirty. That's why we have to be really careful of all the nails that been cut, trimmed, no fingernails. I mean, there's a lot of things that we have to make sure our hair's been washed when we come back from the hospital, because we also care for the family members. So yeah, hospital is very dirty. No matter how much we clean, it's still a lot in the air, it's still a lot on the surface. So what I mean is that make sure you don't like touch it everywhere and put it in your nose, or put it in your nose and touch it everywhere, because without the microscope, you really cannot see a lot of germs that are actually living around you, and you don't want to be germ phobia as well. Otherwise, you will probably need to bring the microscope with you all the time and be scared about everything that you eat and you touch. That's scary. Yeah, I don't like to be germ phobia. I stay when I don't see is clean. I like that mentality. Instead, like, I go like overthink, and I can't do anything much because I overthink that everything is dirty. It doesn't make sense. Okay, so anyhow, so okay, what happened is that the patients with the, let's say patients has high risk for the MRSA, when they come to the hospital, they got swabbed to the nose and see if they have any MRSA infection. Then if they have it, they probably got that from the neighbor in the nursing home or something. However, he or she can get treated in the hospital. And if, let's say, if the patient has like a pressure sore, chances are if they are in the nursing home, they might have something like that. And then those can go to the pressure sore, the open wounds, and get the MRSA to the wound. The wound will not get healed. It go around like that. Okay, phosphorus. And I have phosphorus, 250 milligram, and it's been given 3 times a day. Phosphorus is, it can be a dietary supplement, because whatever we eat have some phosphorus as well, but it's not going to be like enough for those people who wants to prevent the kidney infections or kidney stones. Because what happened is, when you were given phosphorus, the patient's taken the phosphorus, and that makes the kidney that makes the urine to be more acidic. When the urine to be more acidic, and the bacteria cannot be in the urine, so that's treat the urine infection or like a kidney stones. Another medicine I learned is Sebazone. Sebazone is, am I pronouncing it right? Sebazone. Is the medicine, is the opiate medicine that is to treat the opiate dependency. Like some people, addiction. Some people really like addict to opiate medicine, and some people are like IV drug user and stuff. And then when they are given Sebazone, and they are, if they are in like a rehab or treatment, the Sebazone is given is the sublingual medicine. It is the combination of the buprenorphine and naloxone. So buprenorphine and naloxone, combination of that medicines is called Sebazone. And buprenorphine is also an opiate, that narcotic drug. It is any opiate medicine can reduce your breathing, like a respiratory depression, because you don't think about breathing when you are breathing. You're not like thinking about breathing all the time when you're breathing. So without you thinking it, you've been breathing. But opiate medicine, opiate addiction, any kind of narcotic medicine can make you, like morphine, can make you like breathe less. The brain will make you like breathe less. That's called respiratory depression, or reducing the breathing. Naloxone is also naloxone is the medicine that actually block the opiate receptor, so that way the patients with the Sebazone can be treated with the addiction. And the patients could be like starting to have like a nausea because of the cholinergic effect, and they can be given, the Sebazone can be given together with like some anti-nausea medicine like Zofran or ondansetron. Yeah. So there's another medicine is cefepime. It's the antibiotic medicine, depending on what kind of bacteria infections at where the patient is suffering. Then the type of antibiotic and the amount of antibiotics varies. So cefepime 1 gram, 2 gram, depending on that. And when you mix the antibiotic, some antibiotic has to mix with 100 milliliters of normal saline. Some antibiotic like vancomycin is very strong, very thick. You have to mix with 250 ml of the normal saline. So while you administer those kind of medicine, you will see the instructions of how you're going to have to mix it. Colace Colis is the medicine for your bowel movement. So when you have Colis tonight, you're not gonna go to the bathroom and release bowel movement right now, and then usually it will last for a few hours until like next morning when you woke up and you're ready to go to the bathroom. Any other medicine? Gabapentin. Gabapentin can be neuropathic pain. So patients with the gabapentin, patients are on the gabapentin if they have like a pain, nerve pain down shooting down to the leg, stuff like that, and you want to ask them what the gabapentin is prescribed for them, and they are the one, they knows that, and they will tell you what is that for. And some are for like neuropathic pain. Where is the pain? You can ask them. So some people like actually given the gabapentin maybe because of the seizure activities, the seizures they have. So you can ask them what the gabapentin is being prescribed for them. Another medicines is promeprazole. Promeprazole 0.25 milligram 3 times a day, and promeprazole is the medicine that is for like a shaky leg syndrome, or promeprazole is basically the dopamine. So when we have the dopamine level in our brain lower, and we can have like our movement are not smooth no more. So just like Parkinson, like shift, what you call it? Like you have like those pill rolling effects. The patients actually have like this kind of pill rolling activities, or like shaking hands, shaking legs, and also when they walk, and they walk like it's like shuffling and too slow. So those are Parkinson disease, and Parkinson disease is associated with the low dopamine level in the brain. So promeprazole is a dopamine medicine that replaces the dopamine hormone that's needed in the brain so that all that symptoms gets better. In the hospital, you will see a lot of patients with the heparin subcutaneous injection. That's to prevent the blood clots. It's prophylactic treatment that patients usually when they get sick, while they're trying to recover, it's not even recovered yet, they're sick. So they got given medicine, make them drowsy. They got medicine and the sickness that make them like want to stay in bed, not moving so much. So that's blood clots coming. When blood clots come in, blood clots travel to the brain, stroke travels to the heart attack travels to the lungs, pulmonary embolism. There's a lot of complications with the blood clots and a lot of complications if you're not moving around. So what happened is the prophylactic heparin prophylactic treatment for the deep vein thrombosis, which is the anticoagulant, which is the heparin treatment, which is usually 5,000 units a shot, which is a subcutaneous shot that give to the belly. And like insulin, a lot of patients may think heparin subcutaneous is like insulin because it's still subcutaneous, still going through the belly. So it is really give them some education. That's not insulin, because some patients ask me like, okay, they don't have like sugar problem or diabetes, why they're having the insulin. That's not insulin, that's heparin, and the different indication for that, and also different locations that you have to give. For for insulin, you give it like 3 fingers around the belly button, but for heparin, it's best to give to the side of the belly. You don't need to go too close to the belly button, or you just don't need to like go around it. You can do like a left side or right side where the folds is. So, but it's not wrong to give where the insulin's been given. However, it's the best to give it on the side of the belly, okay? So yeah, there's another medicine I commonly see in the hospital is trazodone. Trazodone usually given at night, and I think I warned y'all before that when you give trazodone, make sure patients are on the bed, because the trazodone can make your blood pressure drop, and then the patients can fall like on the floor. So yeah, trazodone is the treatment for the major depression or some, and that's why giving trazodone one time is not going to fix the depression problem. After you give the trazodone for like 2 weeks, then you will start to feel and see the result in the patients starting to get more rest. That's why trazodone is also given for the patients who has chronic sleep problem. So giving trazodone will not make them sleep like Benadryl straight away, okay? It's not the sleeping medicine, it's just a side effect of it. So yeah, that's about it for now. Cefazolin, or the antibiotic mixed with 100 milliliters of amoxicillin. I have so much more medicine that I want to talk about. No time. It's gonna come more educational video like this later. So thank you for listening. Thank you for studying and making the world better with your time and effort that you put in, with the passion that you have, with the talent that the God given to you. So thank you. Please subscribe. Come back. Bye.